Hello and welcome. Today, we're diving into the complexities of neurosyphilis, a serious and potentially devastating infection of the nervous system. We'll explore its causes, how it damages the brain and spinal cord, how it's diagnosed, and what can be done to treat and prevent this disease. So let's get started. Neurosyphilis is caused by the bacterium Treponema pallidum, the same bacteria responsible for syphilis. It's a sexually transmitted infection, meaning it spreads through contact with syphilis sores, usually during sexual activity. Neurosyphilis develops when syphilis is left untreated, allowing the bacteria to spread from the initial site of infection to the brain and spinal cord. It's crucial to understand that not everyone with syphilis will develop neurosyphilis, but early detection and treatment are vital to prevent this progression. Once Treponema pallidum invades the nervous system, it sets off a cascade of damaging effects. The bacteria can directly attack brain tissue, causing inflammation and cell death. It also damages blood vessels within the brain and spinal cord, disrupting blood supply and leading to further tissue damage. This damage can manifest in a variety of ways, affecting motor control, sensation, cognition, and even personality. The specific symptoms and severity depend on which parts of the nervous system are most affected. The epidemiology of neurosyphilis mirrors that of syphilis itself. While the overall incidence of syphilis had been declining for many years, it has been on the rise in recent decades, particularly among men who have sex with men, and in people co-infected with IV. Neurosyphilis, as a complication of syphilis, follows a similar pattern. Therefore, regions and populations with higher rates of syphilis also tend to have a higher risk of neurosyphilis. It is important to note that socioeconomic factors, access to healthcare, and public health initiatives play a significant role in controlling its spread. The signs and symptoms of neurosyphilis are incredibly varied, reflecting the wide range of ways the nervous system can be affected. In the early stages, symptoms may be mild and easily overlooked, such as headaches, stiff neck, and changes in behavior. As the disease progresses, more severe symptoms can appear, including seizures, dementia, vision problems, hearing loss, paralysis, and loss of bowel or bladder control. Some individuals may experience personality changes, mood disturbances, and psychotic symptoms. Due to the diverse presentation, prompt medical evaluation is crucial if neurosyphilis is suspected. Diagnosing neurosyphilis can be challenging because its symptoms mimic other neurological conditions. Typically, the diagnosis involves a combination of blood tests and a lumbar puncture, also known as a spinal tap. Blood tests are used to screen for syphilis antibodies. If the blood tests are positive, a lumbar puncture is performed to collect cerebrospinal fluid (CSF), the fluid surrounding the brain and spinal cord. The CSF is then tested for antibodies and other indicators of infection and inflammation. Neurological exams, imaging studies like MRI, and detailed patient history help clinicians arrive at a confident diagnosis. Neurosyphilis can be broadly categorized based on the timing of its appearance after the initial syphilis infection and the specific neurological manifestations. Some of the classifications include asymptomatic neurosyphilis, where there are no noticeable symptoms but evidence of infection in the cerebrospinal fluid. Meningovascular syphilis, which causes inflammation of the meninges at the membranes surrounding the brain and spinal cord and blood vessels, potentially leading to stroke-like symptoms. General paresis, a progressive form that leads to dementia, personality changes, and motor dysfunction. Tabes dorsalis, characterized by damage to the spinal cord's dorsal columns, resulting in impaired coordination, sensory loss, and characteristic gait abnormalities. The classification helps guide treatment and predict potential outcomes. The cornerstone of neurosyphilis treatment is high-dose intravenous penicillin. This antibiotic effectively kills the Treponema pallidum bacteria. The duration of treatment typically lasts 10 to 14 days. Following treatment, regular follow-up appointments and monitoring of CSF are necessary to ensure the infection has been eradicated. If the CSF still shows signs of infection after the initial treatment course, additional antibiotic therapy may be needed. Depending on the specific symptoms, supportive therapies, such as physical therapy, occupational therapy, and medications to manage seizures or pain, may be prescribed to improve quality of life. Preventing neurosyphilis is primarily focused on preventing syphilis itself. Key strategies include practicing safe sex, such as using condoms consistently and correctly, and undergoing regular screening for sexually transmitted infections, particularly if you have multiple partners or engage in high-risk behaviors. Early detection and treatment of syphilis are crucial to prevent its progression to neurosyphilis. Public health campaigns that promote awareness of syphilis and encourage testing play a vital role in prevention efforts. The prognosis for neurosyphilis varies depending on the stage of the disease at the time of diagnosis and treatment. Early treatment can often halt the progression of the disease and prevent further neurological damage. However, some neurological damage may be irreversible, and some individuals may experience long-term disability. Recent research is focusing on developing more effective and convenient treatments for syphilis, including longer-acting antibiotics. Additionally, researchers are exploring the immune response to Treponema pallidum to develop vaccines that could prevent syphilis infection altogether. Improved diagnostic tools and a better understanding of the mechanisms of neurological damage in neurosyphilis are also areas of ongoing investigation. The goal is to improve patient outcomes and ultimately eliminate syphilis and its devastating complications.